name is Olivia Raybone, and I'm going to be your student nurse today, and I'm going to be performing a head-to-toe assessment. I'm going to go ahead and wash my hands, and privacy is already provided for you. All right, if I could have this, could you verify your name and date of birth for me?
Stacy Kirkendall, 5/18/90.
All right, do you know where you are?
I am at Howard College.
Do you know what year it is?
It's 2021.
And do you know what time it is?
It is 2 o'clock.
All right, perfect. And now regarding the Glasgow Coma scale, your eyes are opening spontaneously, so I rate that as a 4. Your motor responses and your orientation is intact, so that is a 5. And your verbal responses are also intact, so that is a 6. So you are a score of 15, so you are good to go. All right, if you could tell me what you are here for today.
I have a sore throat.
All right, if you could rate that pain for me on a scale of 1 to 10, 1 being least and 10 being worst pain of your life.
It's probably like a 4.
Okay, could you describe that pain for me?
It's like a burning sensation.
All right, is it radiating?
No, it just stays in here.
All right, is there anything that alleviates or worsens it?
Warm liquids makes it better, and swallowing just it hurts.
And when did it start?
About 2 days ago.
All right, well, I'm going to perform a head to toe and try and figure out what's going on, okay?
Okay.
All right, I'm gonna go and get my stethoscope. I will be getting your vital signs. Is there an arm that I need to be avoiding?
No, it doesn't matter.
All right. And then what is your normal blood pressure?
It's usually perfect, 120/80 normally.
Okay. It is 122/80. All right, now I'm going to check your pulse, your respirations, and your O2 saturation.
Okay.
Your respirations are 16, your pulse is 81, and your O2 is 96. Right now I'm going to check your temperature. 97.5. Alright, now I'm going to check cranial nerve 1, which is olfactory, and that regards your sense of smell. So if you could close your eyes, and if you could close one of your nostrils and identify the smell.
Alcohol.
All right, if you could repeat on this different side.
Alcohol.
Okay. Are you having any issues with breathing or like stuffiness or anything like that?
No, I don't have any.
Okay, well it seems like your patency is also clear. I'm going to be checking your nose inside now. All right, I don't see any deviations, polyps, or swelling, or anything like that. All right, now I'm going to check cranial nerve 2. I'm going to dim the lights, and if you would look at me and not look at the light, okay? All right, they are constricting and dilating appropriately. All right, now I'm going to check cranial nerve 2, which is optic. If you could cover one of your eyes and read the one that you can identify.
Okay, 428365.
All right, if you could cover your other eye.
428365.
All right, looks like you have 20/20 vision. Now I'm going to be checking cranial nerves 3, 4, and 6, which is ocular motor, trochlear, and abducens. So I'm going to have this in front of you, and if you could follow it with your eyes without moving your head. All right, it looks like your cranial nerves regarding your eyes are intact. Now I'm going to be checking cranial nerve 5, which is trigeminal. So I'm going to put my hands on your cheeks, and if you could bite down. All right, intact. And now I'm going to have you close your eyes, and if you could identify if it is a sharp or soft sensation.
Okay. Soft. Sorry. Soft. Sharp. I'm sorry.
It's all right. All right, it is intact. All right, now I'm going to be checking cranial nerve 7, which is facial. So if you could give me a big smile. All right, if you could blow up your cheeks and then wiggle your eyebrows. All right, now I'm going to be checking your ears. Are you having any hearing problems, tenderness, or pain, or anything like that?
No, not right now.
Okay, I'm going to be checking this side.
Okay.
Both sides of your tympanic membrane is pearly gray. It looks like your auditory canal. I don't see any edema, redness, or swelling. All right, now I'm going to check cranial nerve 8, which is auditory. So I'm going to come behind you, and if you could cover your right ear, I'm going to whisper a word, and if you could repeat it after me.
Dog.
All right, if you'll cover your other ear, and we'll do the same process.
Pencil.
Okay. All right, now I'll be checking cranial nerves 9, 10, and 12. And 9 is glossopharyngeal, 10 vagus, and 12 hypoglossal. So I will have you stick out your tongue, and I'll be checking your gag reflex. And if you say ah, all right, your uvula is rising, your gag reflex is intact. Now if you could stick out your tongue and wiggle it for me. Also intact. And then it looks like your mucous membranes are pink and moist, so I don't see any dehydration issues. Your dental hygiene is also adequate. Are you having any taste problems or anything like that?
Not right now.
Okay. Now I'll be checking cranial nerve 11, which is spinal accessory. I will be putting my hands on your shoulders, and if you can push against it. Okay. Now I'm going to put on your cheek. All right, seems to be intact. Was there any pain or tenderness with that?
No, I didn't feel any.
All right, I will be now checking your respirations, and I'll come over here.
Okay.
Respirations are clear and unlabored posteriorly. Now I'm going to put my hands here, and if you could take a deep breath for me. All right, that was equal as well. And now I'm going to check for flank pain. If you could tell me if this hurt or is tender.
No. No.
All right, and then while I'm back here, I'm just going to move your hair and check your lymph nodes and your thyroid. If you could swallow for me. I'll check your lymph nodes right here as well. well. If you could let me know if you have any pain or tenderness.
I do not.
All right, now I'll be checking your sinus. Is there any pain or tenderness with this?
No.
All right. Now I'll be checking your respirations anteriorly.
Okay.
All right, I'll be coming under your vest. All right, it is also clear and unlabored. Are you experiencing any short of breath or breathing problems?
No.
Do you have asthma?
I do not.
Do you smoke?
No.
Okay. All right, now I'll be checking your carotid artery. Okay, if you could take a deep breath and hold it for me. Okay, you can release. I do not hear any bruit. Now I'll be checking your cardiac sounds.
Okay.
All right, this is the aortic, pulmonic, Erb's point, tricuspid, and then your mitral, which is your PMI. It's mid-clavicular, 4th and 5th intercostal space, and it is intact. I also heard your S1 and S2 sounds.
Okay.
Do you have any cardiac problems like hypertension or anything like that?
I do not.
Okay. Now I will be having you lay down for me. All right, if you could lift up your chin for me, I'm going to check for JVD. All right, it is not present, so that is good. Now I'm going to be checking your brachial pulses. All right, 2 plus equal bilaterally. Now I'm checking your brachial pulses. 2 plus equal bilaterally. And if you could bring your hands forward for me, I'm going to be checking your cap refills. All right, they are less than 3 seconds, so your circulation is adequate. And while I'm here, I'm observing your skin, which seems to be warm and dry, and your skin turn is less than 2 seconds, so you're not experiencing any itchiness or redness or swelling or anything like that.
No, I haven't.
Okay, all right. And I'm gonna have to take off your shoes briefly. Thanks. All right, I'm gonna be checking your dorsalis pedis pulses. There, 2 plus equal bilaterally. Your posterior tibial. 2 plus equal bilaterally. Now I'm going to check your cap refills. They are less than 3 seconds, so your circulation with your lower extremities is intact. Also, your skin is warm and dry. I'm going to be checking your Babinski reflex right now. All right, it is negative, which is good for your age. Now I'm going to be checking the popliteal pulses. These are also 2 plus and equal bilaterally. Now I'm going to be checking your GI.
Okay.
I'm going to inspect it first. Are you experiencing any abdomen pain or anything like that?
No, I'm not.
All right, well, I am not observing any distension. So now I'm going to auscultate. I will lift this a little bit.
Okay.
Okay, your bowel sounds are normal, active in all 4 quadrants. Right now, I will be palpating lightly. Let me know if you feel any pain or tenderness. All right, now I'm gonna do a deeper palpitation. If you'll also let me know if you feel pain or tenderness. Now I'm going to percuss. All right, and now I'm going to check your joints. So you have this bend. Is there any pain or tenderness with that?
No, I don't feel any.
Okay.
I don't feel any there either.
All right, if you could lift your arms out to the side. All right, any pain or tenderness with that?
No.
All right, you can put it back to normal. I did not hear or feel any crepitus. And then if you could grab onto my fingers and grasp tightly. All right, it is equal bilaterally. Now I'm going to have you bend your knee. Okay, and then lift it for me so I can check your hip joint. Any pain or tenderness with that?
No.
All right, I'll be doing the same on this side. And then lift your, all right, any pain or tenderness?
No.
All right, I did not hear or feel any crepitus on that side as well. All right, and then if you could push against my hands. And then push against, also equal bilaterally. Now I'm gonna have you sit on the side, and I'm gonna be checking your patellar reflex. Okay. All right, it is 2 plus, equal bilaterally. Now I'm gonna have you stand up. All right, I'm gonna have you close your eyes and lift your hands to the side. And I'm gonna be right here in case you have any balance or coordination problems.
Okay.
If you could lift up one leg. All right, if you lift up the other one. All right, you can put your hands down, open your eyes. Any dizziness or balance issues that you experienced right then?
No.
Okay. I'm now gonna have you walk 5 steps forward so I can observe your gait. All right, if you'll walk towards me, heel to toe. All right, I'm not observing any balance issues or anything that needs to be with assistive devices. All right, and if you can sit back down, I'm just gonna check your spinal. All right, it seems to be straight and you're not having any back problems or anything like that.
No, I'm not.
Okay, well, the head to toe assessment is over. Is there any questions that you have for me?
I do not.
All right, well, thank you.
Thank you.